trying to do this morning on the programme is to draw all the strands of this new information about COVID together and try and establish what it means, how it's going to affect us over the next 2 or 3 months. Because, as we know, we have a new variant. It's affecting about 10% of new infections in this country. There is some anecdotal evidence that it might be a bit more infectious than the existing one, but we don't know that yet. The jury's out. But it's all part of surging COVID cases, and we now have the highest daily figures in terms of infections since March, and that was very high. And that means that experts are now, they're talking openly now. This has been bubbling under for about 2 weeks, but it's now breaking cover. Experts are now saying that we're going to get a fourth wave, and that means, as Boris Johnson said, we have a difficult winter ahead. But what does it mean?
Yeah, well, of course, the Prime Minister is focused on the vaccination as the way out, but we have this very slow booster jab rollout.
Absolutely.
And that's causing concern for those at risk. You might have heard this morning that millions are being urged to come forward for their booster dose. Of course, you can't come forward for it until you're called.
Until you're called and given a date.
For it.
Have you got a date for yours? Have you been told?
I'm not at 6 months yet. So next month I'll be expecting to. But the people here at work are eligible and haven't yet been called. So let's discuss this with Head of Public Health, at Exeter University, and Lib Dem councillor Dr Bharat Pankania. Also, the chair of the Independent Care Group, Mike Padgham, and critical care nurse and Unite member, Dave Carr. Very good morning to all.
Morning all.
Well, Dave Carr, you are a critical care nurse. I mean, you're literally at the front line of this because you see people when they're in intensive care. How many of those people who are suffering in intensive care, could perhaps have been protected because of vaccination? Do you have a sense of that?
What I can tell you is that most of the patients, not exclusively, but most of the patients in our critical care are unvaccinated. I'm not sure what that's like in other critical care units. What I can tell you is that most critical care units in the UK are over capacity already. And I think COVID and the continuing COVID admissions has tipped us into being over capacity. And what that means for yourself and for your viewers is that critical care is on the brink at the moment of seriously having problems delivering its core services, and particularly its ability to deliver services for elective surgery that requires ITU beds afterwards. So we are seeing patients cancelled in a more regular way at my hospital and hospitals around the UK because of COVID.
You have worked through both of the main waves over the last 18, 20 months, so you have first-hand experience of what the condition of patients was when they came in, and sadly you saw some of them die, many of them died. Can you give us a comparison as to what it's like now? You talk about the beds being full, but how, basically, fundamentally, how ill are people compared to the way they were in the last wave and the one before that? Is it just as bad in your experience?
So in critical care, it's just as bad. Obviously, they're coming to critical care because they need critical care. But also my hospital provides a very specialist ECMO service. So we see the sickest of the sick, if you like. And there's plenty of work out there for us.
And when you say that almost all of the patients that you're dealing with in critical care are not vaccinated, have you been able to establish why they're not vaccinated? Has it been that they've not been able to get the jab or they chose not to have it?
I couldn't obviously pass comment on individual patient care, but we do know that your chances of becoming sick with COVID are higher if you're not vaccinated, and we still have a proportion of the population that aren't vaccinated. There have been other issues as well. I think there's been issues with pregnant women getting mixed advice on whether or not to have vaccination earlier on in the pandemic. So there has been incidences of pregnant women being in our intensive care units with COVID. And there are people that are extremely vulnerable, let's be absolutely clear here, with double vaccinations that are in COVID intensive care units. But I think the big picture I'm getting, and from my colleagues in other intensive care units, is unvaccinated.
And generally speaking, are those unvaccinated cases in intensive care and the special units, are they people with underlying health issues? Are they people who are obese? Are they people who are elderly?
Yeah, I think what I'm seeing is younger patients, but all with underlying conditions. And obviously, we know that obesity has been a big factor in COVID from the start, and certainly now.
OK, let's talk to Mike Padgham, because the Daily Telegraph this morning, Mr Padgham, reporting that 2/3 of care home residents are still waiting for the booster jab. I mean, this is part of the frustration, isn't it? We're talking about those with underlying health conditions or those who are most vulnerable. Care home residents as we know from the very first days of the pandemic, are the most vulnerable. What is the situation in your care homes, and what access do you have to those booster jabs?
Well, good morning, Susanna. I was quite shocked when I saw those figures in the Telegraph this morning. Personally, in our own care home at the minute, we're doing fairly well compared with the national situation. But I'm concerned for other people in the rest of the country in terms of what's happening, because we know what happened in the first wave. And just like the NHS, social care is under extreme pressure at the minute, particularly over staffing. So not having many staff vaccinated with the booster is a very big concern for us.
And what about the situation with staff? Because it became mandatory, didn't it, for social care staff to be vaccinated. Many people thought that was absolutely right because of the vulnerability of the people that they're caring for. But, of course, you have pressure on staffing numbers, don't you? What has been the fallout of that?
Well, that's one of our main concerns at the moment. We've asked government to reconsider the timeframe that it implements this, because there's a shortage of care staff generally. But if we implement it fully, or the government implements it fully next month, we're going to lose up to 40,000 more care staff. So what's happening is it's piling more pressure on the NHS, because hospitals can't discharge into the community, into care homes, or into people's own homes, because both sectors are very, very short of staff. And that's the problem coming up. If we don't work, the NHS can't work either. So we want the government to rethink what it's doing over staffing issues.
OK, well, let's come to the head of public health at Exeter University. This is Dr. Bharat Pankaneer. Good morning, Doctor. Funneling all the information and filtering it here at this end, kind of journalistically, we are undoubtedly left with the impression that we have become somewhat rudderless in this country in terms of the rollout of the booster vaccines. That whereas we had somebody very much in charge with their hands on the rudder in the rollout of the first two vaccine programmes, it's all drifted. Clearly the boosters aren't being rolled out fast enough. Clearly they're the first-line solution to the problem, but we just seem to be becalmed. Is that your sense as well? That we've lost leadership on this now?
Well, the primary care that did a magnificent job, and by primary care I mean general practitioners, did a magnificent job in delivering the vaccines program. With respect to the boosters, unfortunately, and it is really unfortunate that Secretary of State for Health and Social Care has insisted that you need to do more face-to-face consultations and more GP activities. So the GPs cannot do both, which is run the booster program, especially in care homes where actually you have to take your team with you and go there and deliver the vaccines. So many GP practices have been pulling out of delivering the booster program. And as a result, care homes, like our panelist has mentioned, may not get their vaccines in time.
So are you actually saying then that this morning there will be a GP in practice, maybe with his colleagues, saying we really should be going to X and Y care homes this morning to deliver these booster jabs, but we can't because we have to do surgery, so we're going to have to put it off for another day? Is that what's happening?
That is true, yes. In not in all cases, but they can't be in all places at all times. And this is a clear example, again, of primary care, GP practices being under-resourced. They can run big vaccination centres because there is economies of scale. Whereas with respect to having a team that goes from nursing home to care home is difficult, and they've been made forced to make choices because of this insistence on you will do more face-to-face consultations and other primary care work.
Dr. Pankaneer, you can also get the booster in pharmacies. Is there a role for pharmacists to be going out to care homes, to vaccination hubs? I mean, what changes do you think need to be made in the booster programme to make it work effectively? Because we're reliant on it right now. It's our plan A.
So once upon a time, when we had an integrated care, i.e. public health, primary care, secondary care, we all talked together and worked together, we would have set up a task force, a properly funded task force who could go exactly as you mentioned to care homes, to set up hubs, to set up pharmacies, etc., to do all this. At the moment, unfortunately, it is very much little bits and pieces in an uncoordinated manner, which is a shame.
The mood music on this story is changing daily. This time yesterday, the question was, will we be moving to Plan B? The mood music, if you look across the spectrum of the British media this morning, 24 hours later, is when will we be moving to Plan B? Plan B, of course, let's just interpret that, means mandatory wearing of masks in the way that we used to have to wear them in different settings, working from home more, and mandatory social distancing at shops, etc. Do you think that that would make... Supposing that was introduced tomorrow, would this change anything?
Yes, it should. And prevention is always better. So the sooner you act, the better the outcome. We're almost on the door of November. So Christmas 2021 is not far away. So if you really want to do any preventative work, it is now, which is immunize against seasonal influenza, and clear messages, which is in crowded places, buses, trains, tubes, restaurants, places where there are lots of people, you need to have your infection control measures in place, which is ventilation, stay at home and work from home if you can, and wear your masks properly. It's not only a question of wear your masks, but wear your masks properly. And I have always been advising since the Delta variant arrived, that as it is more infectious, we should also up our game and wear better quality masks. So I have always been saying wear FFP2 masks when you're out and about.
And if you were to get the call from Downing Street today, this is just a little fantasy here, and you were appointed our new booster jab czar, in charge, sole control, people jump when you say jump. How would you fix this delay in rolling out the booster jabs? What would you do? You've talked about the problem with GPs, we've talked about pharmacists. What would you do to fix it so that this time next week we were up to speed?
This is quite easy, actually, Richard. So I would use what I would call targeted booster vaccine program. And by targeted means I would identify the extremely clinically vulnerable. They are the ones who will maximally benefit from the booster vaccines. So I may not get around to covering everyone over 50. That doesn't matter. But I would target people who are really clinically vulnerable and make sure that they get the vaccine as soon as possible. And because you're targeting, you've got a smaller number of people to immunize. This smaller number of people can be immunized properly, quickly, if you have what I said, a coordinated effort, which is either a task force, set up a hub, or set up visiting teams to nursing homes, care homes, etc.
Before we let you all go, Dave Carr, critical care nurse in ICU. What do you fear will happen if we don't move to Plan B?
Well, what we're seeing already is that our intensive care units and our hospitals are filling up with COVID that's tipping everything over the edge in terms of our ability to deliver a normal NHS service. So what I fear is the waiting lists are going to get longer. People are going to be denied the life-saving and life-changing operations that they require. And I'll tell you this, our staff are absolutely shattered at the moment and they are leaving. And I think the same crisis that you're seeing in the care sector, we are seeing in the NHS. And it's not in a few weeks, it is now. Yep. We are understaffed in my hospital, in hospitals up and down the country, and that is making the job that we do difficult and unsafe for the patients that are receiving that care.
Yeah, and Mike Padgham,
it is turning into a disaster.
OK, Mike Padgham, in the care sector, might you introduce individual lockdowns?
Well, I think that we did that for ourselves before the government told us, because we see what was coming. And I'm seriously thinking today, actually, we might need to do the same, because I don't want to wait until it's too late again, like happened in the first wave, because we know what happened. So we're going to be very, very careful and be cautious. And I ask the public to be bear with us if we have to lock down again earlier in care homes.
All right, listen, thank you to all three of you, all speaking from very different disciplines, but all with a toe very much in the water. And I think the collective message that's come out of this conversation today, this morning, is, and if you're watching this, Boris Johnson, which you're probably not, but if you get a chance, it's action this day. As your hero Churchill would have said, action this day. It's time to get on the train.